For me as a hospitalist, I just chose the option for what's called a clinical category, where it's just the general setup rather than a specialty setup. And the very first patient that the ER called me about, I had their patient chart open, and it was a patient who needed to go for an emergency procedure. And I was able to look at their problem list and see everything from the point of view of all of their cardiopulmonary diagnoses, anticoagulation, kidney problems very quickly. I am one of those hospitalists who ask what an ER doctor would probably say is too many questions, because I'm trying to triage what I need to for my patients. And I didn't have to ask that ER doctor as many questions because I could clearly see it. And when I look at the patient's problem list along with their medication list, I really got a great snapshot of everything I needed to know in that very moment in time to take care of the patient. I will show you a little bit, if Jim, if you could go on and go to the next slide for me. I want to give you kind of an overview of what these problem lists look like. What I have here is a very simplified, simple problem list. And this is actually one from a real patient that I recreated in our test environment and took some screenshots on. On the left side of the screen, you can see the active problem list without the categorized view. And you can see that there's really not a rhyme or reason to that problem list, and it's because it's there in the order in which those problems were added to the active problem list. When you turn on clinical categories, you see that it is divided up into cardiac and vasculature, gastrointestinal and abdominal, and then health encounters. And what you can see even on this short list is that congestive heart failure is on this patient's list on the right with verbiage that says congestive heart failure, new onset congestive heart failure, systolic CHF acute, and non-ischemic cardiomyopathy. So you have 4 things that are almost identical that are on that list. So not only can you see all of the cardiac issues in one place, you can also see all of the duplicates that are there, which is really helpful for cleanup.